Hello, I'm Congressmember Judy Chu from California's 27th District. And as one of only two psychologists in Congress, I want to thank the California Consortium of Addiction Professionals for inviting me to speak with you today. But I especially want to thank you for all the collaboration that you have provided me over the years to improve our efforts to those who are trying to recover. This past year and a half has been so difficult for all Americans, but especially for those suffering from mental health and substance abuse disorders. During the pandemic, as many as 40% of adults surveyed reported symptoms of anxiety or depression, which is up from just 10% of adults in 2019. Business closures, job loss, and prolonged periods of isolation have had a devastating impact on the mental health of Americans in every state. And so our job in Congress must be to ensure that our response actually addresses the huge need for mental health services in this country. That's why I'm so proud to have recently reintroduced the bipartisan HR 2767, the Peers in Medicare Act, with Representative Adrian Smith of Nebraska. Our bill would boost peer support specialists by clarifying that there is nothing in current law that prevents peer support specialists from being included in coordinated care teams under the Medicare program, which serves our senior population. This will open the door to ensuring more quality care is covered by Medicare. That's because a peer support specialist is a person with lived experience who's been trained to support those who struggle with mental health, psychological trauma, or substance abuse. Their personal experience of these challenges provide peer support specialists with expertise that professional training cannot replicate. Peers do not replace clinicians, but they can bolster the mental health workforce at a time when it's already stretched thin. As we face shortages in this critical workforce, peers can help supplement the services of clinicians, freeing up their time to see additional patients. For example, if someone comes out of a long-term treatment for a substance abuse disorder, they could find themselves alone in an empty apartment just hours after completing treatment. At these moments, when people are susceptible to feeling isolated, scared, and probably a little uncertain about the future, being able to reach out to a peer support specialist in that moment to talk about how they are feeling can be the difference that helps them make it through those first few hours of recovery. The patient could then follow up with their clinician a few days later for long-term coping strategies, but the peer would have been able to help with that immediate moment of crisis. This issue is important to me because as a psychologist, I've noticed that many in government focus only on treatment and prevention. But there is a third step to the process, and that is recovery. That's why I'm so honored to have introduced the Peers Act, because it focuses on how we can ensure successful and long-lasting recovery for those among us who are struggling. And as a member of the powerful House Ways and Means Committee, which oversees the Medicare program, I'm committed to finding ways to continue to promote access to quality, affordable, and culturally appropriate mental health care for everyone. But I can't do this alone. That is why it's so important that you are all participating today to talk to your members of Congress about the importance of this bill and other mental health priorities in Congress. I know that as a member of Congress, I pay very close attention to what I hear from my constituents, which is that it makes days like today, even virtual ones, so critical. Together, we can build support for the Peers and Medicare Act and pass it into law. And let me also thank you for all your support on my efforts to improve sober living facilities. You endorsed my bill, the Ensuring Access for Quality Sober Living Act. This bill directed the Department of Health and Human Services to develop a set of best practices for residential recovery facilities or sober homes so that patients, families, and states can distinguish quality sober living facilities from sites that are fraudulent or unequipped to offer appropriate assistance to their residents. And it required HHS to disseminate these best practices to each state and authorize the agency to provide technical assistance and support to states that wish to adopt or implement these best practices. I was so thrilled when this bill was indeed signed into law as part of the bipartisan opioid package, the SUPPORT Act, in 2018. Subsequently, the Substance Abuse and Mental Health Services Administration, or SAMHSA, released draft guidelines for recovery residences in accordance with the SUPPORT Act. But what was disturbing was that they didn't do it in consultation with the recovery community as directed by my bill. So you contacted me, and I led a letter with other members of Congress to revise these guidelines with your critical input. Because of this, SAMHSA did revise the guidelines in very important ways, such as in rolling back the emphasis on medical care and treatment for substance abuse disorders. Today, I am a co-lead on Representative David Trone's bill, the Excellence in Recovery Housing Act, which does follow up on my bill by doing, amongst other things, authorizing a $2 million a year funding for grants to implement these guidelines. I know that this bill was crafted with the input of recovery groups such as yours, and so I have the confidence that this bill will move the ball forward in improving the quality of recovery residences. So let me conclude by saying how much I respect the input of the California Consortium of Addiction Professionals. You are on the front lines of fighting the addiction epidemic, and because of you, we've made these bills all about action. Right now, there are sober homes where the staff have been untrained in things like how to recognize an overdose. It's allowed too many people to die in facilities where their loved ones thought they were receiving help. But now we are getting the standards made in consultation with those who know best, and so we can save lives, and it will give families the confidence they need to know they've selected the proper facility. But this is only a piece of the whole puzzle when it comes to solving the addiction crisis. Facilitating the power and strength of peer support specialists and having those who come with that lived experience will dramatically help in this recovery. So I thank you for all your help in making all these bills a reality.
Congresswoman Chu, I just want to thank you on the behalf of CCAPP for presenting today. We appreciate it. Thank you for all your advocacy and everything you do in DC. We so appreciate you and your colleagues and everything that they do for us. So thank you.
Thank you so much. It's great to be with you.
Have a great rest of your day.